And really, it's also the launch of our Access to Genetic Medicine campaign here and in the MDA advocacy team. So we're really excited to be talking with you this evening about these really important topics for many with neuromuscular diseases. And we have some really fantastic guests lined up as well. So why don't we move on to the next slide? I can let you know what we're going to be talking about today. So per normal, we'll start with some introductions as well as a few housekeeping items. If you were here just a minute ago, you heard that this is the first time we're actually using this new webinar system. So if you've been with us previously, this will look a little bit new to you. So we're going to walk you through a little bit of a different functionalities, some different buttons here, there, and so forth, just so you're familiar with them, and so you can also interact with us and ask questions and so forth. Then we're very pleased to have our president and CEO here at MDA, Dr. Don Wood, who's going to give us a few minutes on the importance of genetic medicine and how MDA is really leading the charge as it pertains to bringing genetic medicine to the neuromuscular disease community. And then we'll turn to a deep dive into the current landscape and barriers on how one accesses a genetic test and what barriers might exist in trying to access a genetic test. Same goes for how one can access a genetic counselor and what barriers might exist in trying to do so. And we know there are barriers, and we're going to hear about those. But we're also going to hear about what we're doing at MDA to try to knock down those barriers. And so we're going to have our Director of Access Policy, Joel Kartner, talk about some of the legislative bills, the bills that are out there that are trying to knock down these very challenges for individuals with neuromuscular diseases to actually access a genetic test or a genetic counselor or a genetic specialist, for that matter, for their care. And then at the very end, we're going to take your questions. So please be thinking about those questions as we go along. So we can move to the next slide, and I'll tell you how you actually pose those questions. Again, this is a new system, so we're all going to be learning as we go along. But we really do invite you to submit questions as they come to you as we are talking about these topics. So on the bottom right of your screen, if you see next to the chat button right there, we're going to invite you to click the three little white dots, and you'll see Q&A pop up. And that's the best place to be submitting questions, because that's the perfect place for you to submit a question for us. And then our experts will be submitting answers to you from there. Some might be just through the Q&A box. Some will take live. It might be during the presentations. It might be at the end. But please do use the Q&A function there if you can to ask questions. And don't hold back. We're here to answer as many questions that you have on these topics as we can. For those who would like to utilize closed captioning, on the bottom left of your screen, you see the CC, the closed captioning box there. We've tried it out, seemed pretty good to us. So please feel free if you would like to use the closed captioning opportunity there on the bottom left. And then finally, this is being recorded. So if you're really, really intent on trying to digest as much of this as possible, maybe you're jotting down notes, you can watch this afterwards. We are going to try to have this up on our advocacy webpage, up on MDA's YouTube page tomorrow, actually, is our goal. So you can always go back and watch our experts talk about all these important topics again, so you don't have to be trying to scribble down as much as possible as we go along. So I invite you, if you would like or if you have to leave partway through, whatever it happens to be, the recording will be there to catch up on. Okay, so let's move on to the next slide now that we've covered our housekeeping items. Really excited to have a panel of experts in front of you here today to be talking about access to genetic medicine. We have Melissa Gibbons, who's a clinical genetics and genomics, works in clinical genetics and genomics at Children's Hospital of Colorado, also assistant professor at the University of Colorado, talking about access to genetic testing and access to genetic counseling. We also have Mackenzie with us as well, certified genetic counselor with Genome Medical Services. Mackenzie and Melissa will be presenting on these important topics of how one today can access a genetic test or a genetic counselor and what barriers there may be in front of individuals with neuromuscular diseases. We have Joel Kartner, our Director of Access Policy here at MDA, talking about what we're doing legislatively to knock down those barriers. And then, of course, yours truly moderating our session. But before we get to our panel, I'm really excited we are all really excited to have Dr. Don Wood, President and CEO here at the Muscular Dystrophy Association, with us this evening to speak on MDA and how genetic medicine in the direction we're going within MDA and within neuromuscular diseases is the present and it's the future. So, Dr. Wood, I turn it over to you.
Well, thank you very much, Paul. I hope while I'm talking, I don't have to look at myself on the screen the whole time, but I can do that if I have to. Anyway, great. Let me thank you and everyone who put this webinar together. The concept that you alluded to, genetic medicine, is not something that existed when I was doing research and when I was going to college. Let me give a little bit of perspective. When MDA started about 72 years ago in 1950, looking at muscular dystrophy, which is a genetic disease, as are almost all the muscular dystrophies, um, it was really starting with a lot of hope. Why? Well, first of all, in 1950, they didn't know what the genetic material was. It was still debated whether it was DNA or protein. That didn't get worked out until 3 years later. And and going after a muscle disease at that time was incredible because we didn't know how actually muscle worked. We didn't even know how muscle produced the strength of a muscle. Think about where we've come. $2 billion later. That's what MDA has raised in that 70-year period and spent on research and new knowledge because it required new knowledge. Well, eventually we came to a point where for the first time, we identified the gene underlying a neuromuscular disease in 1986. And it didn't underlie one disease, it underlied two diseases, Duchenne muscular dystrophy and Becker's muscular dystrophy. And you know how many treatments there were at that point? There were none. So genetic counselors, when they were talking to folks, could give them an idea of probabilities and chances that someone in the family might end up with a genetic disorder of like muscular dystrophy. But unfortunately, there wasn't much else there. Now, when I go to now, because we have treatments available, I think we've got, I don't remember how many exactly, but maybe about 15 treatments available over the last few years for different forms of neuromuscular disease. And just to share a little aside with you, I visited with CEOs of 6 pharmaceutical companies in the last couple of weeks. Each one of those companies that I visited had at least 2 new drugs under preclinical or clinical trials. The pace of progress in treatments for neuromuscular disease has accelerated. I anticipate that you will be hearing about 1 or maybe 2 or even more treatments becoming available possibly on a yearly basis from now going forward. That's how exciting this time is. And when I talk to clinicians who head up, MDA has, many of you probably know, a network of care centers across the nation. When I talk to the physicians in there, I can now tell them, you know, it's always sad when you have to tell a patient that they have a progressive neuromuscular disease, whatever that disease may be. But you know what else you have to do now? What you can do now that you could never do before is now the next thing you need to do is start preparing that newly diagnosed patient for entering a clinical trial. That's how fast progress is going. And do you know what you need for a clinical trial now to get into a good clinical trial? You need to be able to identify the specific genetic problem you have. And that's why tonight's discussions are going to be so important. Listen very carefully, ask questions. Ask questions. If you have a disease, neuromuscular disease, and you haven't had your gene identified and the defect to it identified, you need to do that. You need to do that. And when you talk to a genetic counselor, my anticipation is they're all going to start asking you, have you had your gene sequenced and identified the defect? Because that will help you identify the treatment that will be available to you. Like I said, this is a new era. We have never in medical history or human history had a time like this for folks who are wrestling with genetic disorders. And it's my great dream that MDA will continue to help lead the way in new knowledge on how to treat genetic disorders because, like I said, MDA was founded to find causes, cures, and treatments for the genetic disorders we know as muscular dystrophy and related neuromuscular diseases. So again, thank you, Paul, for inviting me to say a few words here. And folks, please take every advantage to talk to the experts, Melissa and Mackenzie here on genetic testing and genetic counseling and the kinds of things you want. They are your very best friends right now. Thank you, Paul.
Perfect. Thank you so much, Dr. Wood. It's really a privilege to have you here with us this evening on our Advocacy Institute, and those remarks were absolutely spot on. So fantastic. Thank you again so much for joining us this evening. So let's move forward with our first topic of conversation, which is the Diagnostic Odyssey with the neuromuscular diseases. Again, we have Melissa Gibbons with us, and just to tell you a little bit more about Melissa. Melissa is a certified genetic counselor and assistant professor at University of Colorado School of Medicine. And Melissa specializes in neurogenetics and neuromuscular conditions at the Children's Hospital of Colorado, with a particular interest in increasing awareness on neuromuscular conditions through education of providers and families. So obviously a close colleague and friend to the neuromuscular disease patient community. We also have Mackenzie Blale with us, who has previously been at the Children's Hospital of Colorado. For there, she was served as a genetic counselor and with specialties and interests in neurology, neurogenetics, and precision medicine. Also working there at the inpatient setting, assisting newborns diagnosed with SMA in the newborn screening coordination of SMA screening there. So we are so pleased to have both Mackenzie and Melissa with us here today to talk to us about the Diagnostic Odyssey with the neuromuscular diseases, how one accesses a genetic test, how one gets to a genetic counselor. And Melissa and Mackenzie, I turn it to you.
Hi, everyone. I know that Melissa and I are super excited to be here. We already have some questions coming in, so we'll be sure to address those kind of throughout the presentation. We can go to the next slide. These are our disclosures. Next slide. So I'm kind of going to bring us back to why we're talking about the topic that we're talking about now. And Dr. Wood already addressed this, but a lot of people wonder, when the neuromuscular disease is on the differential, how do we diagnose it? And it used to be a whole, what we call a diagnostic odyssey, right? So starting with some kind of screening and blood work, maybe a muscle biopsy, nerve biopsy, some invasive, painful procedures. Sometimes we still do nerve conduction testing or electromyograms. But now, like Dr. Wood was saying, really the gold standard is genetic testing. And so that's what we're here to talk to you all about today. We can go to the next slide. And so to bring us back to the basics, how does genetics actually play a role in neuromuscular disease? So like Dr. Wood was saying, kind of genetics 101 is that our genes or our DNA is a recipe for our body. It's in each cell of our body, and our body reads it to know what to make, when to make it, where to put it. For everything that our bodies are made up of. And so our genes are read to make proteins. So that's another word you'll probably hear a lot on the Diagnostic Odyssey. And then those proteins do all the functions in the body. So they make up all of the muscles and the nerves and all of the things that go on inside those cells. And we can go to the next slide. And so when physicians, geneticists, neuromuscular specialists are considering what type of genetic testing to do, as Dr. Wood was saying, we used to only be able to test 1-2 genes at a time. And if we didn't find something, then that was just kind of the end of the road. But now we have so many genetic tests available. So moving on from single gene testing, there are what we call panel tests that test many genes at one time. And then really more often we're doing these really broad tests called whole exome sequencing and whole genome sequencing in hopes of finding an answer for a neuromuscular condition. You can go to the next slide. So when you're choosing a genetic test, and this is kind of where genetic counselors specialize, is how do we choose the right test? And so this is based on a lot of different factors. It's based on, of course, how the patient presents, what they're looking like, if there's any testing already being done, like screening labs or biopsies. And then genetic counselors really specialize in getting into the family history and how that's important in choosing what type of tests we want to do. Next slide, please. And so this is kind of really the meat of our presentation today, right? Is why do we need a genetic diagnosis, and what can we do to get there? And so there are a lot of benefits of genetic diagnoses. These are just a few of them, but our goal with you as a patient is to really shorten that diagnostic odyssey to get to a genetic diagnosis as quickly as we can. And Melissa's going to talk about a little bit more about the reasons why. Um, but alleviating suffering, invasive, painful procedures, psychological burden of that diagnostic odyssey, and then hopefully alleviating some or most of the effects of the condition, as we're moving forward with genetic medicine. Our goal is to improve the psychological impact on the patients and the families, relieving that burden as quickly as we can so that we can move forward towards a treatment of some sort, hopefully. And then, of course, mitigating costs, preventing unnecessary procedures and treatments as well. Next slide, please. But really, as Dr. Wood also was talking about, now it's such an exciting time in genetic medicine because getting a genetic diagnosis can uh, benefit patients by letting them access these treatments. So whether that's something like gene therapy or genetic-based therapies, we have many of them in clinical trials now. Several of them have been approved and are available. And so what our goal is with you is to get from symptoms to some kind of treatment. Slide, please.
So now that Mackenzie has talked to us about the importance of why a genetic diagnosis is becoming increasingly important over a clinical diagnosis, we know that some people are probably sitting there a little frustrated at their computer screen, being like, well, that's great. I want genetic testing, or I haven't been able to get genetic testing. So we wanted to talk about some of the barriers, some of the solutions we have right now, and then Joel's going to lead into some of the things that are coming down the pike. So, the biggest barrier to access to genetic counseling and genetic testing actually tends to be providers that are unfamiliar with this process. Genetic testing is not super straightforward. Mackenzie highlighted all the different testing options we have. So, it's not as simple as when we go in to get our cholesterol checked or things like that, where it's an easy test. We know what to order, we know how to interpret those test results. So, if you have a provider that doesn't order genetic testing on a daily basis, like Mackenzie and I do, it might feel really overwhelming. They have to know how to pick the right test. They have to know, is insurance going to cover this? And how do I even order this test and get it to the right lab? So when we think about test choice, if we know a familial change, that's a little more straightforward. We do a very targeted test, but you have to make sure that you provide the familial information, or else you may not get an accurate test result back. In some cases, with some neuromuscular diseases or neuropathies, we might be looking at setting a broader test so that we can shorten that diagnostic odyssey by looking at a lot of different genetic changes and different genetic diseases that could actually be responsible for somebody's syndrome. When I started even 15 years ago, we did this gene by gene, and it could take us up to a year or longer or never to get a genetic diagnosis for families. Now, some of these panels, we can get a results back in 4 weeks. However, on the backside of those tests, you also need somebody to interpret those results. And we thank you for the question that already came in that Once you've chosen a test and you've gotten those test results back, how do you interpret it? There is a lot that is unknown currently in genetics. And one of the words or a combo of words that Mackenzie and I both hate is variant of unknown significance. It means we identified a genetic change, but we don't actually know what that genetic change does in the body, because being able to identify a genetic change is not the same as being able to interpret that genetic change. And a lot of that interpretation is up to the individual provider. So you can actually talk with a couple of different providers and get some different interpretations depending on what resources they're using, how comfortable or conservative they are with making that call. So when you get one of those test results back, not only do you need a genetic provider like Mackenzie or I, but you also need your clinical provider to put together all the pieces. And sometimes we then actually go backwards. Maybe we do need a muscle biopsy or a nerve conduction study to help back up that genetic test result we're finding. So it's not only with having a provider that's familiar with how to order, but then how to follow up that variant, how to talk to you about what those test results are. The other big thing that's been a problem has been insurance coverage. So each insurance payer, and this varies by state, by insurance plan, by every different thing, has a different way of what they may or may not cover with genetic testing. And typically these tests have been historically really expensive. And so we've always wanted to make sure that there was authorization in place. This used to be up to the provider to obtain authorization. However, more and more labs are now helping out with this and doing benefit investigation. So even if your personal provider doesn't understand the insurance process, the lab can step in to help them out. It's one of the ways the labs have been trying to advance genetic testing on their end. And then the last thing about a provider unfamiliar with the process is, how do I order and where do I order? And that can be super complex if you're not doing these on a daily basis. So if you'll go to the next slide, we'll talk about some of the options of how to get to a genetic counselor. So the first thing I always encourage you to do is start with your local MDA clinic. They are your team. They are the ones that are there to support you through this diagnostic odyssey. If they do not have a genetic counselor or genetic provider that feels comfortable with ordering and interpreting genetic testing, they should be able to help connect you with a genetic counselor. One of the best things to come out of the last couple of years, and I know there's not a lot, has been that the amount of telehealth options has greatly increased across the country. We can still do better, and we still need some access to that, which Joel will talk about as well, I believe, with one of the upcoming bills. But there are now several genetic counseling companies and genetic medicine companies. So even if your community does not have a genetic counselor available, you can actually be referred to one of these nationwide systems that is able to provide genetic counseling ahead of time, assist you with selecting the right test, and then doing the follow-up, which I actually think is the most important part, interpreting those test results, identifying who else in the family may need to have testing based on this diagnosis. Are there siblings that need carrier testing? Are there other affected family members that would benefit from a genetic diagnosis? What are our reproductive risks for this individual and family members moving forward? The second barrier that has greatly decreased over time has been the cost of testing. I'm not saying it's still the most affordable thing out there. However, testing has dropped from several $1,000s per gene to significantly lower. And at this point, most labs are now offering something called a self-pay discount. So if your insurance will not cover the genetic testing, or you have a high out-of-pocket or copay, then you may be able to partner with a lab to do a self-pay discount. And this typically tends to be in the $200 to $300 range, even for one of those panels that Mackenzie talked about. So it does make testing a little more affordable for families. Even better is that some individual pharmaceutical companies, some great support organizations have also come together to really recognize the importance of genetic testing. And they have started these sponsored test programs where you're able to get a test through a lab, typically one that we would order anyways. But instead of having to pay out of pocket, if you meet certain criteria, then you are eligible to participate in a sponsored test program where the sponsors pay for the test instead of you paying for the test. This has really opened up our ability to get testing for people who previously had not been eligible for genetic testing and could not afford to proceed. So we've made great strides over the last several years with access to things like telehealth and decreasing the cost of genetic testing. However, we still have a long way to go. So we're going to wrap it up on our side and pass it over to see what's coming down the pike and how you can help advocate.
All right, Melissa and Mackenzie, thank you so much for that fantastic presentation on giving the overview of the importance of genetic testing, how to access genetic testing, what it can tell you, some of the barriers in front of accessing a genetic test, and the importance of genetic counselors throughout that process. So really appreciate the presentation there. And as you just said, Melissa, we're going to turn it over to Joel Kartner, our Director of Access Policy, who's going to give us an update on several pieces of legislation that try to address these very challenges in barriers to accessing genetic tests and genetic counseling and genetic services more broadly. Before I turn it to Joel, just again a quick reminder in the Q&A box. I know we already have several questions. Thank you so much to Selena, to Barry, to Rose, to Benjamin, to Elizabeth, to Peggy. Thank you so much for writing in your questions. We're going to get there. We are. For those of you who haven't asked a question, or if you have a second one, feel free to put it in the Q&A box and we'll answer it shortly. So with that, Joel, I'm going to turn it to you.
Great. So let's talk solutions. Like everyone else has said, there are a lot of barriers to access to genetic medicine these days, but we are taking steps to solve them. And tonight we're going to talk about 4 pieces of legislation that seek to solve those problems. Next slide. So as you heard, one of the biggest issues with genetic medicine at the moment, what genetic medicine tries to solve is ending the diagnostic odyssey. And so to that point, we have the Ending the Diagnostic Odyssey Act. And basically what this does is it directs Medicaid to pay, to provide payment for genetics medical services. And it also requires a referral pathway to children who need to get genetic testing. And then after the children have been given genetic testing, we then attempt to foster them along to follow-on care so that if there is a disease or condition found, we can get them appropriate treatment. So the only kind of caveat that there is to these actually 2 pieces of legislation is that it only reaches the child and the child in question and the parent of those children. So as you just heard, it often can be very effective to do further genetic testing on siblings of the children in question to be able to shorten their own diagnostic odysseys or for family planning or for your postnatal care, et cetera. So we will be working on advocating around trying to get the access to those programs expanded, but for now we're just held at the child and the parent. Then there's the Precision Medicine for Kids Today Act, which is it's a standalone bill all by itself, but it's also already been folded into a larger package called Cures 2.0. And it essentially does the same thing as the Ending the Diagnostic Odyssey Act, except it also creates various studies to again try and pinpoint where genetic medicine and genetic testing can be most effective. As I stated, it has the same problems as the Ending the Diagnostic Odyssey Act at stopping testing at the children and their parents, but both are a step forward in the right direction for ending this problem. Next slide. Right, so it's wonderful that we want people to get access to more genetic testing, but part of what that's going to necessitate is more genetic counselors. And as we've stated, there are some barriers to getting to someone who's comfortable running these tests. So this mandates coverage of genetic counseling services by CMS, which will hopefully incentivize people to move into the field. It expands access to services both in person and telehealth. Again, as was previously stated, one of the very few things that was good to come out of the last couple of years has been that expanded telehealth use in modern times. And basically, this will allow a genetic counselor to see a patient in another state via telehealth, regardless of licensing issues and, of course, barriers by distance. And then finally, it sets a favorable reimbursement rate for genetic counseling services. Most services in this particular subtitle that is being amended are reimbursed at 80%. This would actually reimburse these services at 85%, which is something we love, keeps our costs lower for our patients, which is always a good thing. Next slide. And then finally, we have increased access to the medicine. We have more genetic counselors. Now we need to get children access to that care. So the Accelerating Kids Access to Care Act is going to make it easier for children to get access to genetic counseling across state lines via the Medicaid program, again, by streamlining the licensing and the enrollment process for out-of-state pediatric care providers that need to see a child in another state via a Medicaid program. So again, a very solid step forward for our community. Next slide. So at this point, I'm going to pass it back over to Paul to talk about how you can take action.
Yeah, absolutely. Well, thank you, Joel. Thank you for the overview on those bills. And as you can see from the bills, they're not a panacea. They're not perfect. Some are focused on increasing access to genetic testing within Medicaid programs. Some more focused towards children, of course, than others. There's the Access to Genetic Counseling Act, which is focused on access to genetic counseling within the Medicare program. Ensuring that genetic counselors are covered providers under Medicare, which, while focused on Medicare, would actually have broader implications because oftentimes private insurance follows what Medicare does, but nonetheless focus there. And then the final bill, of course, accessing specialists across state lines, particularly within Medicaid, given the fact that Medicaid programs, if you have a child who needs to see a specialist in, let's say, Seattle, but they live in Idaho, there can be challenges if they are covered by Medicaid to actually have that care covered. So these bills are very important, and we need your help. We absolutely need your help to try to get some more momentum behind them in order to hopefully actually pass them out of Congress and have them signed into law by the president. And then theoretically from there, we have increased access to genetic counseling, genetic testing, and genetic specialists. So the way in which you can help us out is to take action. And it's actually really easy. There are really just two easy ways to join us. For one, if you're not already part of our grassroots network, you can go to mda.org/advocacy or text MDA USA to 50457. And that way you can become part of our grassroots network. And there you're going to get updates from us every so often on what bills we're working on, what updates we have on the legislation we're working on. If there's a big win, Congress passes a bill we're working on, you're going to be the first one to hear about it. So it's really, really important to be joining our grassroots network to join us in advocating for these pieces of legislation. And once you are there, you will find this opportunity here, which is to call on Congress to support increased access to genetic medicine. And really all you have to do, it's very small on this screen in front of you, but if you were to pull it up on our website at mda.org/advocacy, you would find that all you have to do is put in your information, first name, last name, email, where you're from, so they know which congressperson or senator represents you, and then send you right to an opportunity to send them a message asking for them to co-sponsor this legislation, asking for them to support this legislation. And the more they hear from you, it's one thing for them to be hearing from me or to be hearing from Joel or for them to be hearing from the MDA team, but to actually hear from folks with neuromuscular conditions or loved ones of folks with neuromuscular conditions about the importance of access to a diagnosis, the importance of access to a genetic counselor or to a genetic specialist. All of that goes such a long way in convincing them that this is a priority of theirs and that they should be, at the very least, co-sponsoring this legislation, perhaps even leading the way to try to get it passed. So please do join us in supporting and joining our Access to Genetic Medicine campaign that we're launching tonight as part of our webinar. So you're the very first to hear about it. Okay, so I think with that, we can move on to our final slide, which is our Q&A slide. Before we take a few questions, and I already see that Mackenzie and Melissa have been answering questions in the Q&A box itself. They've been busy. Thank you both for taking a look at some of the questions that are already there. I will say for questions that pertain to maybe specific individual situations of I want to find a genetic counselor in Arizona. I'm having trouble getting genetic testing covered through insurance company X, Y, or Z. Our resource center is there to help you. In our chat box, I know it keeps directing you to the Q&A, but now I'm going to direct you over to the chat. You will see that we put the information of our resource center, if you're not already familiar with them, into the chat box there. You can email them at resourcecenter@mdausa.org. And there we have specialists who are trained to know precisely the answer to your questions. I can't promise they're going to know everything, of course, but they have folks calling in all the time asking these very kinds of questions, calling in or emailing in for that matter. And I do encourage you to reach out to them if you have specific questions of why did my insurance company do this, or how can I find someone specialist in wherever I happen to be, those kinds of questions, because they're very important. We do encourage you to reach out to us. One additional plug before we get to some questions, you also see within the chat box the specific links that I referred to in our previous slide, so you don't have to go type it into your browser. You can just click on mda.org/advocacy or go directly to the campaign with our links there. Really do invite you to join us. Okay, so we have a little bit of time left here in the hour, and I know we've already answered some of the questions in the Q&A already. Again, Melissa, Mackenzie, thank you for answering those questions. If you don't mind, I'm going to take some of these questions, which I think would be helpful for others to hear the answers, because it might be that they are going through something similar with their experience, with their condition, with their family. I know you've already mentioned, you already responded to Peggy when she asked about her 20-year-old daughter and if she should have her genetically tested to see if she's a carrier. Can you tell us a little bit more about kind of that decision-making process of how a genetic counselor or just someone on the care team would be navigating the situation in which an individual is perhaps newly diagnosed with a neuromuscular disease, they have children, and they perhaps want to consider screening for that the very same condition or related conditions in their children. So Melissa or Mackenzie, I turn it over to you if you could educate us a bit on that.
Yeah, that's a great question. I'm happy to touch on that. So another kind of important aspect of getting a genetic diagnosis is identifying other family members who either could be affected or could potentially pass it on to future generations. One thing that we can do as genetic counselors to support you with that is kind of talk through your individual family, of course, the specific diagnosis, and who else in the family should consider testing. Of course, if those people are adults, we always recommend that they get genetic counseling themselves because it is an individual by individual decision. And for like reproductive decisions as well. So if someone wants to get carrier testing and make decisions about pre-implantation genetic testing or prenatal genetic testing, that's something that genetic counselors can help with as well. So really what we do is guide the family through the decision-making process person by person, and help them make those individual decisions for themselves.
And if I'm allowed to jump in, one thing I would just say is that I really encourage giving that opportunity to your kids to meet with a genetic counselor. They may have grown up with a sibling, but typically they're not coming to all the appointments. They really haven't had that comfortable space to sit and talk to a provider and get their questions asked. So one of my favorite parts of my job is I do a neuromuscular carrier clinic, and I actually get to sit down with siblings and relatives. And they get to feel like they're finally getting their questions answered. They're finally being talked to by a professional. And I think it helps them understand their risk. And despite, you might talk about this at home all the time, and this is especially true even for kids that got a diagnosis when they were little. Like Mackenzie said, they weren't old enough at that point to understand and be part of that. So not only do siblings need that, but the kids themselves, as they get older, need to sit down with a genetic counselor and really have that discussion about, well, what is my chance of passing this on? What is the genetic underlying cause of my disease? And I think those conversations are really beneficial. So we definitely encourage you to reach out with siblings and even patients as they get older to have those conversations and let them get to ask their own questions of a genetic counselor or a genetic professional.
And just to put a bow on it, that's exactly why we're advocating around trying to continue to open up these programs so that more and more coverage is given past the child and parent generations.
Yeah, thank you to all three. A very comprehensive answer and spot on. Absolutely. We have a couple questions about the intersection of access to genetic testing and Medicare. We have a question from Amanda as well. Oh, well, actually a question from Amanda on this very topic. And of course, we've been talking about access to genetic counseling within Medicaid and also studies that are commissioned by these bills that would further prove not only the clinical utility, perhaps, of the importance of genetic testing, but also oftentimes the financial or economic utility to an earlier diagnosis for the insurance company, whether they're public or private, of what benefits to them of having actually a more accurate diagnosis for whoever they are covering in order for more targeted care to be offered, and perhaps care that otherwise we know was not going to be effective will no longer be offered because of that diagnosis. In any case, what I wanted to ask to Mackenzie and Melissa is about, because we know that actually at our care centers, we did a recent survey. At our care centers, about 30% of folks at the MDA care centers are covered by Medicare. And so consequently, we imagine for those who qualify for Medicare either because they're over 65 or because they're diagnosed with ALS, or because they qualify for Social Security disability insurance, they then qualify for Medicare. And that's a lot of individuals with neuromuscular diseases. Can you tell us a little bit about your experience in navigating perhaps the Medicare system with patients that you've seen that they're hoping to get a genetic test, you're hoping for them to get a genetic test, but Medicare might be either throwing up some hurdles or perhaps refusing to pay for it altogether. So if you could each tell us a little bit about that intersection of genetic testing and Medicare and what advice perhaps you might have to the community if they find themselves in that situation.
I think it's we're both hedging because it's a difficult topic. Obviously, as the providers, it can provide frustration, but not anything compared to the patients themselves not being able to access this crucial piece of their journey. Um, our, our advice is to kind of find the loopholes that we can. And so that's something that Melissa and I have gotten really good at. It's one of our areas of expertise is, can we do a smaller test? Can we do a different test? Can we work with a different lab who has better deals with Medicare patients or can offer a lower self-pay price? So typically what we kind of have to do is find those loopholes for our Medicare patients, and we're more than happy to do that. Sometimes it ends up just not being something that we can do, but it's something that we work really hard with to fight for that access for those patients. One thing I always also encourage patients to look for are labs who have patient assistance programs. So these are the programs that if your income is under a certain level or you qualify for disability, they'll either discount the price of the testing or offer it for free altogether. So there are specific genetic testing labs that will do that, and your local genetic counselor should hopefully have an idea of what those are and try to help you get the testing that you deserve, every patient deserves.
Yeah, thanks so much, Mackenzie. Melissa, did you want to say anything additional?
No, I was going to say Mackenzie just did a really great thing. And the only other thing to add in is that although these are federal programs, they differ state by state, and each hospital system also differs and their thing. So that makes it really hard. So you may hear from a friend that this wasn't covered or this happened, but again, it's in your hospital system in your state may have different rules associated with all of this. And I think that makes it really hard because sometimes I'll have an option that Mackenzie being at a different institution doesn't have as well. So federal program, but not administered federally for everyone the same way.
Yeah, that's a very good point. Absolutely. We got a question in actually for MDA, and this comes from, let me make sure I'm pulling it up right here. Yes, Dr. Benjamin Brooks. Dr. Brooks, thanks for asking this question. It has, and Dr. Brooks says, insurance payers look to evidence or consensus-based guidelines to develop payment policies. Is MDA supporting these guideline developments disease by disease, or more broadly for neuromuscular diseases, ALS, etc.? It's a very good question. I don't actually think I have a very straightforward answer for you, because I don't think necessarily it's one or the other. I think what we would do here at MDA, and we do this within our professional education efforts, as well as particularly as it comes to care standards and other kind of putting forward consensus, such as the consensus documents that you're referring to. It depends. Sometimes it might be very disease specific, especially if there is a need in a specific disease area. Other times, especially if there is perhaps a common challenge across, whether it be a subset of neuromuscular diseases, perhaps mitochondrial diseases, or perhaps myositis, or perhaps it's muscular dystrophies. Maybe there could be some more kind of cross disease efforts there. Maybe even across all neuromuscular disease for that matter. I don't want to roll that out, but I think it does depend. I wish I had a more straightforward answer for you, Dr. Brooks, but I think certainly it's something we're very interested in doing. But I think it does depend a little bit on the opportunity in front of us on which we do. But I do encourage you to reach out to us if we in the advocacy team aren't the right folks to connect you with. If you're interested in MDA's work in this area, you can reach out to us at advocacy@mdausa.org. I probably should have plugged that email earlier. That's how you can reach our advocacy team, advocacy@mdausa.org. And then we're going to be sure to get you to the right folks within the organization to have that conversation if you'd like to have it. So, Dr. Brooks, thank you very much for that question. So we have an additional question about, and this is from Rebecca and Mackenzie. I see that you just got to it, but I think it's a very good one. So I want to see if I can also ask it live to you, and you can answer live again, perhaps. But Rebecca asks, are genetic tests, blood tests done at special labs, or would those be done at any local lab? So it gets a bit to the accessibility of the variety of different tests that can be useful. Blood tests are useful. Genetic tests, obviously, we've been talking about, very useful. How does that all work? Can they be done locally? Are they done centrally? What would you say to that?
Yeah, so like I briefly mentioned, specific genetic tests are typically done by genetic testing labs. So there's certain certifications and qualifications genetic testing labs have to meet in order to be considered clinical genetic testing. But certain tests that your doctor may order related to your condition, like CK levels, those kinds of things, those can be done locally, kind of just at any LabCorp or Quest Diagnostics. Those kinds of labs will do that kind of testing. And some basic genetic testing as well. But once you start getting into more specific, disease-specific genetic testing, then that's where you're going to be sending the test to a specific genetic testing lab.
I think the other thing in that sentence too was the great thing about genetic testing is we've actually expanded our samples too. So we can do genetic testing on blood, but a majority of our genetic tests can actually be done in a cheek swab or a saliva kit. So I work with a multi-state region. I sometimes have patients come in and we need to coordinate their testing afterwards. Instead of arranging for them to come into a local hospital or coming all the way back to Denver, I can now send the cheek swab or saliva kit and they can actually do home collection. So being able to expand our specimens, having labs that now will accept all these different types of specimens and have made it really easy for us to send kits to home has actually also increased the access to genetic testing as well.
Yeah, thank you so much, Mackenzie and Melissa, on that. Those are really fantastic answers to that question. So thank you for that. Amanda poses another question that's kind of following on to our conversation on Medicare. And what Amanda asks, and I'm going to take the first crack at this, is how we can get Medicare more interested in adults who need genetic testing for atypical health conditions, as Amanda says. They're so focused on the typical, and that this is a problem for those of us who are black sheep, as Amanda perhaps calls herself, or calls those who are close to her. It's a very good question. Medicare is primarily a federally run program. It is run by the Centers for Medicare and Medicaid Services, and as both Melissa and Mackenzie have said already, there are local aspects to it or state-based aspects to it. Medicare can make coverage determinations either as a national coverage determination or as a local coverage determination, and it kind of depends on what specifically it is, depending on what they choose. But it can, since it is more of a top-down approach than, either Medicaid programs perhaps, or even especially some private insurers, as it pertains to whether they be insurance plans one could buy off of a healthcare marketplace, or even privately insured companies. You get your insurance through employers. Then those can be much more locally or personally perhaps focused than sometimes the Medicare program can be. So it's not. I would say I'm not surprised that Medicare might have more trouble than others when it comes to ensuring that the precise care or diagnostics are covered for the more rare conditions, certainly that can come across for Medicare. I'm gonna say one final thing before I turn it to Joel for anything else you'd want to say. For these 4 bills, especially the 2 that are especially focused on genetic testing, there isn't a whole lot on Medicare within those 2 bills, and so perhaps this could be the 5th bill that we look to introduce and add to our genetic access to genetic medicine campaign. But before I overpromise, certainly, Joel, I don't know if you have any thoughts further on the intersection of Medicare coverage and access and genetic testing.
I think what I'll say on the subject is there is a lot of congressional interest in the subject. Like I think combined between the 4 bills, there are something like 32 co-sponsors. I might be overshooting a little bit, but it's pretty close. So there's a lot of interest within the governmental space in getting involved in these treatments. So it might be as simple as talking to a local congressperson and telling them, hey, this is an issue for me and people like me, and sharing your stories. Because as we say quite often here at MDA, your stories are individually powerful. So just kind of making that noise to tell your congressperson that that's action that you would like taking is a good first step.
100%. Joel, very well said. Absolutely. Okay, well, we have just a couple minutes left in the hour. I am going through here. So we have a question from Barry, and this one, tell you what, I think this might be the last question we have an opportunity to answer. Let's see. But Barry asks about changes in genetic testing and variants of unknown significance, and feeling sure about the validity of the results, and perhaps in interpreting the results of a test. I've heard some say a genetic test is only as good as the diagnostician who is interpreting it. Perhaps there are times in which one geneticist, one genetic counselor, whomever happens to be trained in interpreting that test, might think one thing, another might think another. So what is one to do, perhaps? What is a patient to do when they might find themselves in that situation? And then to follow up from that, and this is to Mackenzie and Melissa, what about the situation in which genetic testing is evolving, and new iterations of tests might say something different than older iterations, for that matter?
And I apologize, Barry. I kind of tried to address this a little bit in my section on kind of that need to have a genetic professional involved with the interpretation of that test result. I think this is something that we all struggle with when you get those variants of unknown significance. It's putting together the genetic testing, the evidence that's available the day you read the report, and also your personal history. Have you seen this variant before? Have you seen this variation of what this disease may look like? And putting that together with the clinical presentation. And so when I speak with families, we're always very cautious to say that our interpretation is kind of as good as today for a variant of unknown significance, because we're constantly learning more, we're constantly getting more evidence about these genetic changes. And we're starting to better understand the phenotypic spectrum. So what are the differences across a lifespan that this condition can look like? Mr. Woods had this earlier, we identified when we got the dystrophin gene, we got 2 diagnoses because we got Duchenne and Becker. Well, we thought they were 2 diagnoses. We got the gene, we realized they were 1, and they represented the different ends of the spectrum, and there's everything in between. So there's still just a lot in medicine, and especially in genetics, that's up to individual interpretation. And I know that can be super frustrating. I know both Mackenzie and I have sat in rooms with families and read a report and did interpret it different than the person prior to us, and maybe took away a diagnosis or altered something. And it's just really important to stay in connection with your genetic professionals because we're learning more, these reports are amended. We get more information, we get more clinical pieces, maybe we do some follow-up tests. All of those things are how we go into interpreting it. But sometimes there's not one right answer for some of these variants of unknown significance, and that can be frustrating both to the patient and to the provider. I'm sure Mackenzie has stuff to add on that as well.
Yeah, I would agree. We, like Melissa had said, we can get so much information now. We can sequence your entire genome, but we don't always know what to do with a lot of that information. We're finding so many variants. So I would say, like, between myself and any other person on this call, there's 3 to 4 million variants that make us different from each other. So when we find those, we don't always know what to do with them. Most of the time, they just make us different from each other. But sometimes we need to dig a little bit more, keep an eye on them. The labs are working on keeping an eye on variants more, depending on which lab. And yeah, there's definitely an art to it. And we hear you and we are always there to answer questions as they come up. You know, getting a genetic testing done isn't always end of the diagnostic journey. We fully recognize that. And so we want to be part of the journey as it continues.
Awesome. Well, you know, I said that was going to be the last question, but we just had one more come in that I really love. So we got 2 minutes left, and it's going to be the last ones from Brad. Brad, great. Thanks for joining us today. And he asks, what is the best way for a person to revisit their diagnosis to see if a variant of unknown significance has been deemed pathogenic at a later time? So perhaps there was a variant of unknown significance was identified earlier on. Maybe it's been a little bit. Maybe it's since we've actually found that that variant is actually pathogenic. How should an individual kind of navigate that decision-making process, perhaps with a genetic counselor involved?
Yeah, I want to be very clear that I don't make money by advocating for genetic counselors, but definitely check back in with your genetic counselor, your genetic professional, or whoever ordered the test, if that's your neuromuscular doctor or your neurologist. They can always reach back out to the lab that issued the initial report, ask them if that classification has changed. Like I mentioned, most of the labs are now trying to keep on top of those reclassifications. So if there is a reclassification, they typically will send a new amended report to whoever ordered it, so the provider. And we can always manually also check on your variant as well. So the people who know how to check those databases can check variants as well. So talk to the genetic counselor, the provider who ordered the test. At the very least, they can always contact the lab who did the genetic testing and have them double check the variant.
Same thing. I normally tell families we should revisit the variants on a yearly basis, at least until they've all been reclassified.
Okay. Well, very good. Well, look at that. We are right at the hour. We're at 8 o'clock Eastern time, for me at the very least. First of all, a big thank you to our guest speakers, Mackenzie and Melissa. You've been both absolutely fantastic, not only with the presentation, but answering all of these great questions. So thank you again for your time this evening. I know everybody is very grateful for it. Also, a big thank you to Dr. Wood, who was able to stop in for a bit to share MDA's vision for genetic medicine going forward. And thank you to all of you for taking time out of your Wednesday evening or afternoon, perhaps, to join us to talk about MDA's new Access to Genetic Medicine campaign. Just to reiterate, please do join us on the Advocacy Network, as well as taking action, asking your congresspersons, your representatives and senators to support these important pieces of legislation. And tune in next month. We hope to be back with another Advocacy Institute here shortly. So with that, thank you all and have a great rest of your day.